My name is Ryan Bates, patient, along with our guides if needed. Here's the 360 and my supplies are over here. Okay. Hi, my name is Ryan. I'll be the nurse practitioner student performing the eyes, ears, nose, and throat exam on you today. How are you feeling?
I'm feeling good, thank you.
Good, glad to hear it. Let's start with an eye test. Can I have you hold this about 14 inches from your face and read? We'll begin with your right eye. Cover your left eye for me and then read the lowest line possible.
LTFPH.
Awesome. Let's switch and then do the same for me.
LTFPH.
Okay. And then uncover both and read the lowest line possible.
LTFPH.
Awesome. Your vision is good. Thank you. Next, we're going to go with our vision fields exam. I'm going to hold my fingers here. You tell me when you can see me wiggling my fingers when I bring them forward, okay?
Okay, I see them.
Okay. And keep your eyes right on me. You're doing good.
I see them.
Perfect. Let's go upward.
I see them.
Awesome. Lower.
I see them.
Good job. Do upward.
I see them.
Good job. And we'll do lower.
I see them.
Next, we'll test the vision near your nose. Can you cover your eye for me? I'm going to bring my fingers in wiggling from the right side, and you tell me when you can see them. Right, you're already on it. Let's do that again, though, just for official purposes.
I see them.
Perfect. Let's do it the other side.
I see them.
Great job. Now I'm going to go to inspection. All right, I'm going to use this and I'm just going to get this ready because I know it's going to take me some time. Because I don't. There we go. All right, I'm going to take my finger. I'm going to have to give you something to do is hold that. And I'm going to pull down your lid. I'm going to have you move your eyes side to side so I can see, make sure everything's okay, right?
All right.
All right, I'm going to pull this down. Go ahead and look side to side. All right, let's do it on this side. Everything looks good. Your conjunctiva sclera is white. Your conjunctiva is pink to clear. Next, what I'm going to do is I'm going to have you follow my finger. I'm going to look for any shaking of your eyes, any extra weird ocular movements, okay? Awesome. Next, it's going to be the pen light. I'm going to point this at your eyes and see how your pupils move when they constrict together, okay? So I'm going to shine it. I'm going to be gentle. It's bright. I'm going to make sure that pupil constricted, this pupil constricted. Now I'm going to shine it in this pupil and see if this one constricts, okay?
Okay.
That will be a normal sign, and it did. We'll do it on the opposite eye. It did. Your pupils are equal, round, and reactive to light. Next one is going to be the ophthalmoscope. I just turned it on. I'm going to go ahead and check for a red reflex. I'm going to look for just a red flash in there by the way I'm holding it. Awesome. I see that. Now I'm going to get kind of close, okay? I'm going to put this against my eye and look in. And I'm going to check for any lesions, hemorrhages. Make sure all the vessels look good. Your optic disc is clearly visualized. I'm going to go to this side. And I'm going to look for any lesions, hemorrhages. Look at your optic disc. Your eyes doing okay?
Yep.
Good job. And it looks the same on both sides. Awesome. Alrighty, next is going to be, sorry, I'm just checking.
You're okay.
Let's go ahead and cover one eye. I'm going to test for any deviation of that eye. Awesome. Other eye. Alrighty. And let's do that. Go ahead and open it. Awesome. There's no deviation of either eye. Next, what we're going to do is we're going to check out your ears. Do you have any tenderness when I feel?
No.
Okay, I'm just touching your ear auricles, your trachea, and your mastoid. Any tenderness?
Nope.
Okay. Doesn't look like there's any lesions, edema, redness, nothing like that. We'll go on and do our otoscopic exam.
Okay.
I'm going to hold this upside down, press it against your head. I won't go super far in. I'm going to pull on your ear and look back and look at your eardrum and along with the ear canal, okay?
Okay.
And I'll do this on both sides, starting with the left. Okay. Right, everything looks good. Your tympanic membrane is nice and pale. Your ear canals don't have any swelling. You haven't had any ear pain recently, have you?
No.
Okay. Let's check your right side. Okay. I'll be nice and gentle. All right. And everything looks the same on this side. Great. Now we're going to do a couple hearing tests. I'm going to have you cover and put your finger in your right ear. I'm going to whisper 1 2-syllable word in your left ear. I want you to verbalize what I said, okay?
Okay. Hello.
Good job. Let's do it on the other side. Honey.
Honey.
Perfect. Good job. Couldn't think of anything but butter. Sorry, I'm just checking here. Okay, perfect. We're on the right track. Next, what I'm going to do is I'm going to take this tuning fork. I'm going to smack it together, put it on the top of your head, and you're going to try and hear the vibrations, and you're gonna tell me whether one ear is not picking it up as much as the other, or if they're equal, okay?
Okay.
I'm gonna slam it kind of hard, so it might startle you. There we go. It's in the center of your head. Does that feel equal in both ears?
Yeah, it feels equal.
Awesome. Let's go ahead. I'm gonna do one side to the other side now.
Okay.
First one will be touching this to your mastoid process behind your ear, and then I'll check for another type of hearing, okay?
Okay.
So you tell me when you cannot feel that anymore or hear it anymore.
I no longer feel it or hear it.
Okay. Tell me when you can't hear that. Might be a long one. You can hear it, right?
I can hear it, yep.
Good job.
And I no longer hear it.
Okay, let's do the same thing on the other side. Tell me when you can't hear that anymore.
No longer hear it.
Good job. That's texting hearing by conduction. Tell me when you can't hear this anymore.
I no longer hear it.
Awesome. Next is going to be your nose. I'm going to have you hold on to this again.
Okay.
First, I'm going to look to see if there's any asymmetry, any lesions, any swelling, any tenderness on your nose. Is there any tenderness?
No.
Okay. How about on your sinuses when I press down? Are there any tenderness behind there?
No.
Okay. I do notice a little bit of asymmetry off to the right on your nose. Is it hard to breathe out of either side?
A little bit on this side.
Okay. Can you go ahead and occlude the left nair for me and try and breathe in? Okay. Let's do that on the other side now with the right. Yeah, definitely feels or sounds like there's a little bit of less flow on the right side. Do you mind if I take a look in your nose?
Of
Can I have
course.
you tilt your head back? Everything looks good. Awesome. And we're gonna look up on that side. This side does look a little more narrow. That lines up that you're having troubles hearing on that side. Your turbinates, which are pink kind of folds back there, those look good on both sides though. That's good. Good. And I didn't notice any masses or tenderness to your nose. Next is the mouth, okay?
Okay.
So this one I'm going to use the light and the tongue depressor. I noticed that your lips are pink, moist. You haven't had any cracking or sores?
Nope.
Okay. Have you had any sores in your mouth? Any tenderness in any one spot with your teeth, gums, lips,
No.
back of your throat, tonsils?
Nope.
Okay. Go ahead and just smile for me. I'm just going to look at everything. Can you pull your lip down? Good job. And then lip up. Good job. Everything looks good. I don't notice any lesions or discoloration. Say ah. Okay. Your tonsils look good. No exudate, no white spots. How about the back of your throat? I couldn't see that. One more time. There we go. Awesome. Looks good. I looked at your hard palate and your soft palate too, along with your tongue, gingiva and teeth, oral mucosa, pharynx, and your tonsils. I didn't notice anything wrong, so that's good.
Thank you.
There is no discoloration, lesions, sores, same thing, nothing like that. Last, what we're gonna do is your neck and head lymph nodes. Usually when you get kind of sick, those can become swollen. What we often do is look for the absence of that upon palpation. If you have any tenderness when I am rubbing along, let me know, okay?
Okay.
We're gonna start with your periauricular, your post-auricular, and I'm doing this bilaterally, and then your occipital, okay? And then your tonsillar, your submandibular, your submental, your superficial cervical, your anterior cervical, posterior cervical. I think I can feel those actually. Not a bad thing. I know you've been a little sick recently, right?
Yes.
Okay, and that's just extra drainage. I'm surprised I can feel those actually. And then your supraclavicular, and then your infraclavicular. Okay, any pain or tenderness when I'm palpating those?
No.
Alrighty, that concludes our ears, eyes, nose, throat, and lymph node exam. Thank you.
Thank you.